Shortcuts is what people are looking for nowadays, precisely because we live in a fast-paced society, and people do have obligations to family, work, and social, and they cannot have much downtime. If you just think of ourselves, I can't have much downtime. People that I know and my family, my circle of friends, we cannot have much downtime. We don't have the luxury of that. So the shortcut procedures have become in vogue in the last 10 to 12 years. The Botox injections, which just requires a few minutes, the Restylane and Radius injections, and all sorts of in-between shortcuts, the mini facelifts that require the threads only without significant amount of cutting, the mini brow lifts. All these procedures have a role. They will improve the patient to some extent, and again, it all depends on the amount of aging that a patient presents with to know if they would be appropriate. We're not going to do something that's a shortcut when a patient comes in with a terrible hang in their jowls and cheeks and neck and eyes, and cannot be done. One thing that is a wonderful shortcut technique is a fat injection, a fat transfer technique by doing a mini liposuction on someone's thighs or hips, taking the fat and feeling the hollows in the face and the cheeks is a wonderful technique that works. Of course, it has to be done correctly and has to be staged in several sessions, but it does work, it is permanent, and it's a relatively easy and small procedure that surprisingly gives such nice results. It does enhance and fill out a person's face. As we age, our face hollows and droops. The fat does bring back some of that youthfulness. And again, this is a procedure that is done as a short outpatient procedure with minimal recovery time. So the fat transfer, the fat injection operation is something that we do advocate here, and it seems to fit that bill of a small recovery time with a lot of improvement.